Hi everyone, we're going to talk about perinatal anxiety and depression and its best practice. It's presented to you by Linson, Medina, Frozen, and Shukri.
Types of depression a woman experiences during and after pregnancy are known as perinatal and postnatal depression. Perinatal depression refers to the start of conception until a year after the baby is born, whereas postnatal is a month after the baby is born up to a year after birth. According to the World Health Organization, both depression and anxiety are considered to be a mental health issue. Depression is a brain disorder classified by persistent depression, mood, or loss of interest in activities, causing significant impairment in daily activities. Anxiety, on the other hand, is also a mental health disorder classified by a feeling or worry of important anxiety, an emotion that is so strong that it affects your daily living. 1 million women experience perinatal depression and anxiety yearly, yet only 15% receive professional treatment. 1 in every 5 mothers of children aged 24 months and less have been diagnosed with depression, yet it is reported that more than half of these women were diagnosed with depression during the perinatal state.
Perinatal anxiety and depression can be caused both mentally and physically. The risk factors are past or present mental health problems, previous or current abuse, recent life stresses, experiencing severe baby blues, complications during labor, multiple birth, single parenthood, and unsettled baby, and realistic expectations about motherhood. In addition, the relationship between the parents during the perinatal period is another critical factor. Enhancing the communication, emotional closeness, and relationship satisfaction plays a significant role in preventing perinatal anxiety and depression. Moreover, women during the perinatal period are frequent smokers or constantly exposed to secondhand smoke. Active smokers are found with anxiety and depression disorders. Cessation smoking is necessary and various interventions are required. Furthermore, breastfeeding is a significant challenge for first mothers as it requires time commitment and it causes physical pain. Thirdly, previous perinatal loss can lead to a consequence of suffering from perinatal anxiety and depression. Women who were pregnant after stillbirth or miscarriage are more likely to have elevated levels of anxiety and depression.
Common disorders which are experienced by individuals throughout this stage include depression, anxiety, bipolar, and OCD. Symptoms we could look out for include poor fetal attachment or not being able to share a bond with the newborn, frequent crying, feeling of hopelessness, restlessness, fatigue, agitated, or being overwhelmed. Issues related to appetite, unreasonable weight loss or weight gain, lack of concentration and interest in activities once seemed pleasurable, social withdrawals, feelings of worthlessness, guilt, fear of not being a good mother may lead to anxiety and panic attacks, leading to either sleeping excessively or suffering from insomnia. Leading to physical symptoms such as bad headaches, experiencing chest pain, hyperventilating, gastrointestinal issues, as well as chronic joint and limb pain. Many also result in life-threatening thoughts and actions, which does involve unwanted negative thoughts, including thoughts on death and suicide, causing harm to baby, inflicting non-suicidal self-injury, which may also lead to symptoms of psychosis, hallucination, delusion, aggression, rapid or incoherent speech, or being unaware of their own behavior.
Perinatal depression and anxiety is one of the most common medical complications during pregnancy. There are several screening tools available and validated for use during pregnancy and postpartum period to identify patients with perinatal depression. For example, the Edinburgh Postnatal Depression Scale. It consists of 10 self-reported items and easy to score.
Fortunately, pharmacological and non-pharmacological treatment is available. Behavioral therapy, interpersonal psychotherapy, and psychodynamic therapy have shown great improvements in depression and anxiety symptoms. Counseling is also useful to make informed decisions as well as giving a sense of support. Medication can also be prescribed for more severe symptoms as first-line treatment or in conjunction to non-pharmacological therapies. Medication used to treat depressions are selective serotonin reuptake inhibitors and tricycline antidepressants. Benzodiazepines can be used to treat panic attacks and severe anxiety disorders in short term. Research has shown that women who discontinue the use of medication in perinatal period are more likely to experience a relapse than those who continue the course of their medications. Cognitive behavioral therapy has shown to be beneficial in prevention of prenatal depression and anxiety. The goal of CBT is to help women identify, evaluate, challenge, modify dysfunctional belief, and alter maladaptive behaviors. Other methods such as relaxation, yoga, and meditation can all be beneficial. Joining support groups, sharing your thoughts and feelings with other parents going through the same situation can all be therapeutic. Obstetrical care providers have an increased role in detection and early intervention of these disorders. Provide them with information about where to seek help. Beyond Blue and Panda are some of the few organizations that support women during perinatal period. Advise them to talk to family and friends and encourage them to attend regular appointments with their health professional. You might want to ask what prevents pregnant women from seeking help. First of all, women are less likely to recognize the symptoms, especially when they haven't experienced it before. They could also be reluctant to seek help, especially from the doctors, who they may fear will give them antidepressants. There is also stigma attached to depression, false belief that their depressive symptoms are somehow related to not wanting the baby and not being an ideal parent. It is important to educate them regarding these conditions and remind them they are treatable.